on behalf of Navi Mumbai Community Specialist Dr. Amey Sonavane, Consultant, Hepatology and Gastroenterologist at Apollo Hospitals, Navi Mumbai. Welcome to this webinar session, Doctor.
Thank you.
The first question is, where is the liver located in our body?
So the liver is a very important organ and it is located in the upper abdomen, just up beyond the right rib cage where the right lobe exists and the left lobe exists just below the left rib cage. So it is basically located in the upper part of the abdomen.
So, what are the functions of liver?
So liver is a very important organ as I mentioned, and there are various functions that the liver performs, and most important functions include detoxification of various bad products, especially like ammonia, production of free fatty acids, production of proteins, production of clotting factors and glycogen. And the most important function that the liver functions is excretion, production and excretion of bile. We'll take this again. So,
What are the functions of a liver? Can you explain?
So the liver is a very important organ of the body and it performs various functions. The most important function that the liver performs is production and the excretion of bile. And there are certain important other functions that it performs, which includes detoxification of all the waste products, especially ammonia, and production of proteins, production of free fatty acids, production of clotting factors, as well as glycogen.
What is hepatitis?
So hepatitis is a very broad term and it just indicates inflammation of the liver.
And what is acute and chronic hepatitis?
So hepatitis basically divided into two types. One is acute hepatitis is when the symptoms last for less than 6 months and it is caused by acute viral hepatitis A or E, and chronic viral hepatitis when the symptoms last for more than 6 months and it is caused by chronic viral hepatitis B and C.
Are there any symptoms or causes of hepatitis?
So patients with hepatitis, maybe whatever reason that they have, if the cause is, can just be asymptomatic at times. But when they have symptoms, they can have jaundice, loss of appetite, some pain in the upper part of the abdomen. They can present with joint pains, they can present with fatigability, malaise, fever, vomiting, or just nausea.
What is a viral hepatitis?
So basically, viral hepatitis is a type of hepatitis. Basically, before proceeding to that question, answer we'll consider
What is viral hepatitis?
what are the causes of hepatitis.
अच्छा ठीक है परत ये विचार. So what are the causes of hepatitis?
So there are various causes of hepatitis, and the most common cause of hepatitis is viral hepatitis. And the other common causes include alcohol-related hepatitis, non-alcoholic fatty liver disease, that is fatty liver-related, steatosis and hepatitis, certain genetic causes like Wilson's disease or hemochromatosis, drug-related hepatitis, or any bacterial or parasitic infection of the liver that can give rise to hepatitis, or even an autoimmune process which is called as autoimmune hepatitis.
Now you want me to take viral.
What is viral hepatitis?
What is a viral hepatitis?
Viral hepatitis is something which is called by a hepatotropic virus, and these can be many. The common hepatotropic viruses that we deal in our day-to-day practice include viral hepatitis A and E, which are acute viral hepatitis, and viral hepatitis B and C, which are chronic viral hepatitis. There is also viral hepatitis D, which can happen only when the patient is infected with viral hepatitis B. Other than these hepatotropic viruses, there are certain other viruses which can cause viral hepatitis, which includes Epstein-Barr virus, cytomegalovirus, herpes simplex virus, and the common dengue and coronavirus.
Is viral hepatitis preventable?
Yes, viral hepatitis is preventable, especially the hepatitis A and B, which have got vaccines against it. So viral hepatitis A has got an oral vaccine or an IV vaccine, which requires 2 doses to be given, and viral hepatitis B has got an IV or IM vaccine which has got around 3 doses to be given. So we'll take this again and I'll put it in a letter.
Is viral hepatitis preventable?
Yes, viral hepatitis is preventable. Viral hepatitis A and B are specially preventable diseases, and by taking vaccination we can prevent these. For viral hepatitis A, there is a vaccine available and this requires 2 doses, and for viral hepatitis B, there is another vaccine available which around requires 3 doses.
What is fatty liver and how does it causes hepatitis?
So fatty liver is just basically accumulation of fat into the liver. And this is the broad term that we call it is non-alcoholic fatty liver disease. And the spectrum includes just plain fatty liver, to inflammation of the liver, which is called as NASH, that is non-alcoholic steatohepatitis, to cirrhosis of liver, to liver cancer.
What is the treatment for fatty liver?
Basically, fatty liver is a lifestyle disease, and the risk factors include insulin resistance, diabetes mellitus, obesity. The best way to prevent fatty liver is to ensure that you have a healthy lifestyle, you exercise regularly. The exercise regimen should consist of a warm up, of an aerobic as well as an anaerobic part, as well as a cool down. Along with exercise, you must ensure that you have a low fat and low carbohydrate diet, that you aim for a weight loss of around 5 to 7% of body weight.
So, doctor, how does alcohol affect the liver and the body?
Alcohol itself causes a lot of accumulation of fat in the liver, and alcohol can cause something which is called as alcoholic hepatitis. Alcoholic hepatitis, if left unchecked, can give rise to cirrhosis of liver as well as liver cancer. So there is certain amount of alcohol or the duration of alcohol which dictates if the patient will have alcoholic hepatitis. And the safe drinking levels for any man or women include less than 3 to 4 drinks per day to less than 14 drinks per week for men, and less than 2 to 3 drinks per day to less than 7 drinks per week for women.
What are the other causes of hepatitis?
So the other causes of hepatitis, other than alcohol, other than fat, other than viral, include certain bacterial and parasitic infections, certain autoimmune conditions like autoimmune hepatitis, or certain genetic problems like Wilson's disease or hemochromatosis. There are certain drugs which can also give rise to hepatitis, which includes antibacterial drugs, paracetamol, which is crocin when we take it in a large amount, certain anti-epileptic drugs, certain anti-tubercular drugs, certain oral contraceptive pills, as well as statins, which are lipid-lowering agents. All these and many more drugs can cause drug-induced liver injury or drug-induced hepatitis.
We come to the last question. Are there any diagnostic tests for hepatitis?
So there are certain diagnostic tests which are easily available, by which you can find out if you're having hepatitis. For the blood test, it includes liver function tests, which includes SGOT and SGPT levels, as well as the alkaline phosphatase and the GGTP levels. It is basically the SGOT and the SGPT levels that give us an indication of any damage to the liver parenchyma. Also, prothrombin time is a very important test which tells us about the good functionality of the liver. Serum albumin is another test which tells us about if the liver is functioning well. Basically, if you have abnormal liver function tests, we are advised to evaluate it further, and the further evaluation consists of an ultrasound examination of the abdomen as well as serological tests for viral hepatitis B and C if indicated.
Thank you, doctor, for joining this
Thank you.
session.
Thank you so much.